So we have with us Dr. Geetima Khanna, a dentist with BDS and MDS qualification. First of all, welcome in 10 News.
Thank you so much.
So my first question is about what inspired you to pursue a career in dentist domain?
Yes, I would say actually dentistry has always fascinated me because mainly I myself am suffering from many congenital dental problems. Many of us are suffering from dental problems since our birth. So I was also one of those, and like a layman, I would say I was not very interested in getting a dental treatment done because I was so scared of visiting a dentist, which my father used to take us every now and then. So then certainly with looking at their instruments and how they work was quite a fascination, I would say. And then later on I thought, why not me also? I can, because I was quite interested in knowing about my body. So knowing about my body, doing my biology, I was always attracted towards knowing more and more. And then of course there was a thought of becoming an MBBS also, but like I said, the dental problems were more, and around me as well I used to notice people are complaining about this and that. So I thought, why not, instead of taking up an MBBS, let's become a dentist. That's something different also, which
Yeah.
nobody had done in my family before. So I thought, let's become a dentist instead of becoming a general physician or something like that. So I think that was the thought where I started my career as a dentist.
Interesting. Can you describe the most rewarding aspect of your practice?
Yes, there have been many times where I have been, because my specialty is, especially I'm a periodontist, which would mean pediatric dentist. I work for children mainly. Up till 18 years of age is where we count everyone as children. So I can work both on middle teeth and I can work on permanent teeth as well with expertise. So there have been many phases where we work for children and even adults also. I work for adults as well. So I see many children who are mostly scared by their parents already visiting a dentist or a doctor as such. So they don't want to come to you. So managing a child patient itself always is a very rewarding thing. Not, I think everybody can handle a child.
Correct.
And let them work on their teeth. And then when they actually smile and thank you, that's the biggest reward. I mean, you cannot feel that feeling that somebody was not even ready to sit on a chair and now has got everything done by yourself. That's very rewarding, I would say. And every patient is important for me and they're very special. There have been many cases, I would say, not pinpoint a single one, but many of those.
Yes, it's really rewarding. And what are the most common dental issues you encounter and how do you address them?
See, mainly if you understand the fact that why people would visit a dentist is only when they're in pain. That's the general thing. Maximum patients you would see, they only come to a dentist when they are in pain.
Correct.
But somehow pain, you need to understand, is a very higher level of your problem, where your body started complaining to you also that yes, it needs attention. So before that also there are many signals that your body will give to you. Maximum times we are dealing with pain. So patients who have multiple cavities and they've landed up in pain is when we actually give them relief by performing things like root canal treatments, or might be if the pain is exaggerated a lot, so we do a lot of extractions and then giving them artificial teeth by doing implants or dentures or whatever it is required as such. So maximum the pain treatment is what is involved in dentistry, because it's like if patients are generally coming to you for a regular checkup, like at least annually or maybe in 6 months, then you would not suffer from so many problems. But somehow the bad luck is that still people are quite neglecting their oral health. So we are maximum dealing with situations like pain even in children and in adults the same way.
Then what's your recommendation for maintaining optimal oral health
Yes, I would
basically?
say that's really important. That's most important, because people should know that it's not at every time when only they are suffering from pain or some situation that they need to visit a dentist. A dental treatment is not dental treatment, I would say a dental checkup is actually prescribed every 6 months for everyone. So you need to visit a dentist since your first tooth has arrived, or even before that, I would say. When the child is born, when you start cleaning their gum pads is when the oral hygiene maintenance actually starts, even before the teeth have erupted. So after the teeth have erupted, you're given a good cleaning tool which is known as toothbrush, which everybody is aware of. So toothbrushes are also of many types. So you can, your general toothbrush which everybody use every day. So brushing the right way is most important. The kind of toothbrush that you can use is the softest bristle that is available to you, and you can actually dip it in water before brushing so that the bristles would become soft. because we brush every day. You cannot actually keep brushing it too hard because my enamel will also erode. So we do not want that. We would want my enamel to stay the same way forever. So we brush very gently and it is followed by meals. So basically twice a day brushing is recommended. For children at least 2 minutes of brushing is recommended. For adults it can take a good 4-5 minutes of brushing because the number of teeth are more. So when you brush after your meals, like after breakfast and after dinner is what is actually needed, and after your 2 brushing, other than your 2 meals, when you are having anything in the daytime like your snacks or anything, your lunch or anything, because we can't keep brushing every time, that would be over brushing. So after every other meal you can rinse out thoroughly. Rinsing is very important. That's really important because after every meal whatever gets stuck inside the gum line, you need to remove that. So immediately if you rinse
Correct.
followed by your meal, it will not just get settled inside, it will come out most of it. And then at night time you would brush. Brushing at night is really very important, and I've seen maximum I see patients are not brushing at night time. So
Only in morning.
yes, and that too you just get up and you brush and that's it. That's not some job that you're doing. You're doing it to maintain your teeth. So brushing after meals that's why very important. And when you've brushed at night, morning you haven't had anything, so eat your breakfast and then you can do a good brushing again. And throughout the day focus on rinses, more and more rinses. If possible you can do warm saline water rinses, that would help you more because the gums health is also going to be very good if you use salt water for your gums. But if not, at least plain water is good. And apart from that, like I've already told you, 6 monthly dental checkup is a must, because scaling is one thing which people are not very much aware of. That scaling is a must again, because not everything can you remove with your brushing. The gum line will always be full of food where your brush would not reach. So what you need to do is get a professional cleaning done. A thorough cleaning session would help all of it to come out so that you are not followed by cavities or bad breath or stains on your teeth, and so many things which can be saved with that. That's very important.
If anyone wants to take suggestions from you, then what's the contact? And
Yes, absolutely. Actually, we are working at a branch of clinics by the name of Dental Solutions One Care. Our main branch is in Sector 40, Noida, and we have other branches as well. I can just share my website, which is Dental Solutions One Care, Dental SOLNS One Care, where you can visit and you can know further about us. Also our contact number, which is 4214809 and 9871672228, where you can call up and fix up an appointment, at least get your checkup done, because anything else we can always take care of, because we are a team of experts who are working. We are only working specialty wise, so every dentist would take care according to your need, so that the particular treatment plan is made according to you and only served by the specialist that you would need. Not anybody would work for you, so that would make it easy and the best way possible. So thank you so much for contacting me, and I would always welcome all my patients because I love working on patients. That's my passion now. And children, I just love to work on them and make them smile throughout their life, giving them a lesson which even the parents, they are very thankful and they appreciate that we were also not aware of, and now we would take care of our teeth as well. So all of you can maintain your teeth forever if it is done in the right way. Thank you so much.
thank you, Dr. Geetima Khanna, for talking today.
Thank you so much.